I'm delighted you could join us this morning. These are weekly casual discussions to talk about what's going on and where we're headed. And Charlotte, it's great to meet you for the first time. And I love hearing these stories. This just gives us an opportunity once a week. I usually start off with three things. What am I jazzed about? This is kind of my weekly ritual. What am I jazzed about? What am I learning, and what are we working on? So I'll just kind of plant the seeds with that. Obviously, we had a fantastic event yesterday. It worked so well to bring those practitioners in, and I've known each of them, some for a long time, some are more recent, and they're coming from different perspectives. And I was kind of not nervous, but I was kind of wondering, okay, how is this going to mesh together with the different areas they're coming from? Because obviously Dr. Dunn and Dr. Ernst are both chiropractors who have gone way beyond the core chiropractic profession, and then Dr. Rote is a naturopathic doctor, and I've spent a lot of time with him. I've known him longest, the last year and a half, and then Amanda LaPlante comes in, with her health coaching perspective as well. I go, okay, how's this going to work? How are these conversations going to go? But it just blended so beautifully, and I didn't hear anybody like stepping over anybody or contradicting or whatever. It just kind of like built up the whole thing, and I had a grin on my face the whole time.
Yeah, I think when you connect on a heart-to-heart level, we all know what the end goal is, right? And we all have a part to play. So
yeah,
it works.
I piped in for a few minutes. I had a call before that ran over, and then I had a call in the middle. So I came in and said hello and got the gist of it, the chiropractor piece, but it's well respected.
Mm-hmm.
So, well, the whole recording's out there, and it's funny. Each of these sessions, I'm thinking it's going to go. Well, obviously that was scheduled to be 45 minutes or so, but even these sessions, I'm thinking, let's just get on for 15, 20 minutes, half an hour, however, and we have to shut them off after an hour because people want to talk about this stuff so much, and there's so much to cover, and you mentioned the chiropractors. I've been going to chiropractors probably more than 30 years, and like any profession, there are folks that are just focused on cracking backs and doing adjustments and that kind of thing. But so many of the chiropractors that I've met have branched out so much more broadly. And when we're Charlotte, you were talking about people that are having difficulty transitioning, especially if they're in conventional medicine, transitioning into more holistic healthcare, functional medicine. We've found that chiropractors are one of those groups that seems to transition more easily because they've got such broad training in nutrition and whole body systems and that kind of thing while they're going through school. It's much more of a kind of natural progression for them. So, and then they often go off. I've got a chiropractor friend who's went off into acupuncture, and now she's developed an expertise in hypnosis, and she travels all over the world speaking at conferences on hypnosis. And I mean, starting from that core education as a chiropractor, and then obviously Dr. Dunn, same kind of thing. She was a chiropractor, kinesiologist, and then went off in this field of epigenetics and went deep in that.
We had a great conversation after the call yesterday.
Yeah. Did she tell you where she was?
What?
Did she tell you where she was, or did I happen to mention that?
She's in Manhattan now?
Yeah, she flew up there because I don't know how she made this connection, but there's a movie, and I have to get the name of it. I actually want to put a link to it on the site, but there's a movie about this field that we're all working in. And it's supposed to have had, pretty phenomenal response. And and she met the producer of the movie. And he learned her background. He said, I'm making another movie. You got to be in it. So that's why she's up in Manhattan. She's filming her section of the movie, right? The second movie.
Awesome.
So
That's awesome.
we'll get all that info out there, and that's what this is all about. So I was really, really jazzed about that yesterday. And
what's the movie about? The new one?
It's all about holistic healthcare, and I apologize for not. I'm blanking on what it was all about, but I'll definitely get the information and put the links out there. But the second one is going to be supposedly pretty powerful too, and these are Hollywood level production movies that are kind of rattling the cages and changing people's thoughts about the work that we're doing. So pretty exciting stuff. And and the other thing that I'm really excited about is that, last week we talked about patient case studies and that kind of thing. And I don't know if and so Charles immediately went out there and put a case study library out there that we can start building on. But then he also started building out not just started, but he's built out an extensive journal and research library. And so where we see that going is, as you're doing your work with patients and in your practices, I mean, obviously the healthcare profession works on validation by peer reviews and case studies and that kind of thing. So we want to, and this is largely prompted by the conversation we had last week. I mean, this is already kind of in our vision that we wanted to do this, but we jump-started it last week when you all started having the conversation about it, is the ability for you to take the work that you're doing, bring it in a case study, or first on a case report thing with your patients, maybe bring some other experts in the collaborative to help navigate through that, then produce a case study, and then there's this rich library of resources to get those things published, and that's just going to bring more and more credibility to the work we're doing. Because like Charlotte, I was talking with Charlotte, it would be great if you could just like replay some of those things that you told me earlier about the practice that you're working in, and she's working with a conventional medicine doctor who's very skeptical about this for all the reasons that we know. And but the more and more that they can see this stuff grounded in real science and grounded in things that have been tracked and codified and written up for hundreds and hundreds of years, and that's what you'll see in those journals out in the library. So that's kind of one of these things that I'm really excited about. So Charlotte, you and I had a great little conversation. Would you mind like netting that out and for Holly and Joe?
Yeah, so I've been working with a traditional medicine doctor of primary care, and I met her through a yoga studio where I teach, and I was doing a workshop on Ayurveda. And I find a lot of crossover between functional medicine and Ayurveda, just in, even the dis-ease, meaning lack of ease in the body. And I had developed a cleanse, and she was initially very skeptical about what the word cleanse meant. But again, it was lifestyle, like cleansing yourself of bad habits and stuff. So she did the program, and then started recommending it to some of her patients who had arthritis, and they had maxed out on pain meds, and she didn't know what to do. And she had felt the benefit of this. And she even had a good friend who couldn't get pregnant. And then after doing, and again, the cleanse was just food, there were no supplements. Her friend got pregnant, and she called it her cleanse baby. And we met, and we actually looked at, renting space, doing something together. She was going to do a private practice. But when it came down to the risk that she would have to take to do a private practice, she just decided that, she's a single mom, and she just wasn't willing to do that. So we started and she tried to get me into, she worked in one of the big Boston networks, and she was able to get all the way up the medical chain. People were interested in me coming in, but she couldn't get the operations manager to sign on. And so couldn't get me in to just do, you know, like little 6-week programs about, you know, upgrading your breakfast, upgrading your lunch. And she's looked at, there's actually a practice out in Western Mass here. I'm trying to remember what the name of it is, but they do a really great job of incorporating health coaches and massage therapists and getting insurance companies to pay for it. So she went and she visited this woman and, you know, came back all inspired, but there were so many obstacles. And so we decided to do something outside of her practice, a 1-year program where every week there's a different lesson on just, you know, maybe it's sugar, maybe it's, you know, sleep. So that's where we've been going. You know, unfortunately, there hasn't been, like, our open rate is maybe 40%. And because of COVID, we had planned to do some, you know, in-person types of things. And without that, I think we haven't gotten, we're still struggling with how to get the engagement, because behavioral change is just really challenging. And I think, you know, part of it is people don't realize how important it is, how easy it is, and how important it is. And I think you kind of have to feel it in order to believe it. So yeah, that's where we are. Oh, but I guess what I was saying was she really values lifestyle and how lifestyle can affect your health. But when it comes to functional medicine and the testing and even the types of studies that we reference, that's where she does not feel comfortable. So we respect each other, and I think hearing why she hesitates to do vitamin D levels is really helpful for me. And I think, you know, when, just like we say with our clients, I think we have to meet each other where we are. So like we have to meet, you know, allopathic doctors, and allopathic doctors, you know, try to meet us, and we meet in the middle somewhere.
Yeah, that is such a beautiful example. And so many, I love the little pieces of those stories, those little nuances, like this is their cleanse baby. I mean, what a fantastic little thing to say. I hope he doesn't mind me talking about this, but Dr. Rattay told me when I first met him, we did a bunch of tape sessions, and I was asking him about his profession and how he does stuff. And he was telling me about this patient who had had some tragic family things happen in her life. Her husband died, 2 of her children died, and she went through this horrible period. And simultaneously, she was struggling with a range of chronic illnesses. And she had been to literally dozens of conventional medicine doctors and dozen treatments and pills and all kinds of things. And literally nothing worked. And so one of the things that Dr. Rattay does, which is what all of you do, is listen to the stories that are happening with these people, what's going on in their lives. And he discovered that she had in her basement, she had a whole collection of files that were all of the medical records that she had collected, all the communications with doctors and everything else that she had been built up over the course of her family members, her sons and her husband going through these illnesses and passing away. And he said, look, we've tried all the physical things. He said, go take all that stuff and burn it. Just get rid of it. Get it out of your thing. And she listened to him and pulled those things out, and all of a sudden her recoveries started going. She had to get that weight, that psychological weight, off of her, of these anchors that were down in her basement of all this medical history. And you think, okay, so how would that ever happen ever in a conventional medicine office? It wouldn't,
That's what I had shared yesterday, that as coaches, we have that unique ability to sit with people in those stories. We're the ones that they open up to. Just like in a regular practice, it's not the doctors they open up to, it's the nurses, right? And you really need to value those support professionals on both sides of the fence, because, you know, we're the ones getting, you know, down in the muck with them.
Right. So
The doctors don't have enough time to spend with their patients. And it's not that we're down in the muck with them, it's that we give them that pregnant pause so that they can say what they're thinking and what's on their mind and go deep in thought and do the work of processing the information that's in their brain in order for them to realize what the results are. Because we can't tell them what the results should be. They have to discover it for themselves.
I think our side of the fence values that, though. I mean, like, we recognize that. I think all of us, the chiropractors, the functional doctors, the naturopaths, you know, this side of the fence really sees everything as connected. So we know that, you know, the junk she has in her basement is connected to the junk she's dealing with in her life. It's not a far leap the way we're trained on this side of the fence to make those connections. You know, where the training on, well, and I know because I came up through the biochemistry research, I mean, it's data, it's a data point, and it's a single thing, and then this is what you know, link to it. It's just one thing, you know? So here's the problem, here's the solution, one-to-one, problem solved.
Yeah.
And we know it's this.
Well, and Holly hit right on it. It's the time.
Yeah.
And Charlotte and I were talking before that you two came on. We were talking about, you know, conventional medicine doctors come up through medical school and they're trained on diagnose, prescribe, diagnose, prescribe, diagnose, prescribe. And it's so I don't think a lot of people recognize or realize the extent to which the pharmaceutical companies are controlling the medical school curriculum. I mean,
The doctors don't even know it, because I've had doctors tell me, oh, I'm not, you know, I was on my soapbox one day on Facebook, and I put a post and I just said that I was fed up with the doctors, you know, riding the coattails of the pharmaceutical industry. And I had a friend that came up and posted, and he was like, I am not, you know, I try, I do this. Sorry, can you see me?
Yeah.
Okay, because my screen went blank for a minute. My docking station is giving me issues, and when I pounded my desk, my screen went blank. So, you know, they don't even realize that they've been brainwashed into this, you know, it's just, you know, and I'm always prefacing what I say then. I mean, we hashed it out, but I said, yeah, I get it. You try to tell them it's their diet. You know, I mean, you know, you've got a person in there who's, you know, who has erratic blood sugars, and you know they're heading down the road to diabetes, and you tell them they need to watch their diet, but you only have 8 minutes to convince them to give up whatever it is, their soda, their beer, their
it's better if they
ice
figure
cream,
it
whatever
out.
it is, and you're not going to do it in 10 minutes.
It's better if they're educated about it, and then they figure it out themselves and they see the connection, the correlation.
Right.
Yeah.
Yeah,
And
exactly.
that's the whole thing. You can't do it in 10 minutes.
Well, you know, I really feel for these conventional medicine doctors, because they're really, really trapped if you think about it. I mean,
and they're trying. They're
trying, but they're trying with the tools they've got, and the tools they've got are pharmaceutical drugs and surgeries, and you know that I mean, and to Holly's point, in your point, they've only got 8 or 9 minutes to make a decision, and then move on to the next patient. That's why we're working so hard, not only in the clinical things in the collaborative, but also on the practical business things of how do I run a profitable practice when I'm not relying on insurance? How do I run what's the right practice model for me with subscription pay or concierge, or whatever. There's a variety of models that are out there to get there from where I am today. And many of you are in a much better space, because you've you've learned how to make money without insurance in many cases. And,
I was just going to ask, does anybody know what the percentage of health coaches that are getting the certification so that they can collect insurance? I mean, it's not something that I'm personally interested in. And one of the reasons is it used to be that chiropractors weren't covered under insurance, and now they are. And now that the insurance companies get to dictate how much they get paid. And it's really the good ones who don't take insurance, and they're the most successful because they're good. It's the ones who are mediocre in their practice who have to go out and take insurance.
Yeah, I find that the chiropractors, at least in our area, the ones that do take insurance are very, like, I've been to them, and then I've been to ones outside of the box, right, that don't, and who have added different things to their practice. And the chiropractors that are in the insurance model look more and more like allopathic doctors. Oh, your neck hurts, let me snap your neck. Oh, your shoulder
Right.
hurts, let me readjust, and it's very much targeted to the one thing, and I could go for a year and have the same 4 adjustments done over and over and over. And, and it gets to the end of the day and you go, well, why is that always out of whack? What's the deeper root cause of my body being out of alignment? Like, it's great that you can put it back in, but if I have to come back in 2 weeks later and have you put it back in again, something's wrong.
Right.
Right? And insurance still will only cover so many visits.
Good morning, Dr. Bermudez. It's Robin.
So what are our practices doing about having what are practices doing about health coaches? I mean, not everybody can go to a model where I forget the name of the model, where they're collecting fees per month per patient.
Like a membership model or a concierge model.
Or subscription models. Yeah.
Yeah. If you don't have that kind of model, how can you bring on a health coach in your practice or refer to the health coach? What is the relationship like, and how do you foster that?
Charlotte, I think you've worked out some of that in your work, in your practice. Can you speak to that a little bit?
Well, for me personally, it's all cash, so there's no insurance involved. And I just wanted to kind of echo, my sister's a physical therapist, and since insurance has changed, she doesn't take insurance anymore, so it just wasn't worth the hassle it was. The insurance companies were rejecting it just to see how persistent people were to try to get it covered. So I have decided not to try to go the insurance route. What I do know from, and again, if you're interested, I can try to get this practice out in Western Mass. I know the doctor speaks at a lot of independent medical doctor conventions about how she was able to run this practice. And what they'll do is the doctor is involved with everything, like even the massage. So the doctor would come in and say, look, they need this because of this and this and this. And because the doctor was in the room and there's a couple of things the doctor has to do, they can bill it under insurance because the doctor had something to do with it. And the same thing with the health coach visits, and maybe, she just opened her second building. So it's a fairly successful practice. The doctor might just pop in for 5 minutes out of an hour visit, and then it can be billed to insurance. And the woman who does the insurance billing and set it up, she spoke at this convention as well. I don't have the specifics, but that's kind of the general way, as long as it's all about coding and figuring out what types of codes have to be done, and how much the doctor has to touch that visit.
And it's considered a referral or some type of whatever the jargon is in insurance terms. to make it happen, to make it politically correct in the insurance world.
I mean, I don't know if referral, because it's not like they're referring to another licensed. I'm not sure if it's referral or just, it could be a co-program. And one of the things that they do, and this is what we were trying to do at her hospital practice, was have, have group talks. And then she might have to like maybe do a couple of, basic, whether it's blood pressure or whatever, at the beginning of the 6 weeks and then at the end. And then that would be, or if the doctor is just there for a certain portion of the group visit, then somehow insurance can be billed. And I apologize for not having the specifics, but we didn't end up going down that route because you would have to hire somebody to do that too, to do the billing and to, understand it. But it's being done.
I Googled Western Mass. There's the New England Center for Functional Medicine, Northampton Integrative Health and Wellness, Alternative Healthcare.
It's I think her first practice was in Northampton. There's 2 practices.
Okay, so Northampton Integrative Medicine, maybe?
Maybe. What's the doctor's name?
I'm Google. Hang on.
While you're looking that up, Holly, what we see is there's a short-term answer to that question and there's a longer view answer to that question. And we're actually working on both. The short term is how do we blend those models, like you said, and help practices understand how to blend insurance-based compensation with subscription model and or concierge type of membership. There's a variety of interesting models that are working. There's a practice here in St. Louis that's just took off like a rocket. They're called Palm Health, like palm of your hand health. And they put together a blended model and were able to do it. And they were opening practices all over the country. Robin Stewart, who's has done a bunch of recruitment for them. So those models are starting to work, and that's some of the work that we're doing in the collaborative to help people figure out what's the right compensation model and profitability model that's going to work for them. In the longer view, we've got to change insurance, and we're working with a variety of people who are in the insurance industry or have been in and around the insurance industry to get insurance to move in the right direction, which means, and even there's somebody in the collaborative who really wants to start his own insurance company that strictly compensates holistic healthcare, and so that's going to take a while to make that move. But in the interim, we're working on these blended models to help people figure that out, because one of the things I said yesterday on our call is we've got to look at the system as a whole. We're certainly working at the grassroots with practitioners and patients, but we've got to address the pharmaceutical industry. We've got to address the insurance industry, and all the pieces that make up this system of healthcare that we're under. And you're absolutely right. I've known and have been a patient of the chiropractors who are probably not the best kind of chiropractors you want, because they get you on a treadmill of adjustments. And largely that's because of the insurance payments that they're getting. And that can get really, really costly, it's profitable for them, but it's not the best thing for the patient, like Joe was saying at all. And so arriving at those different models that work, I think, is crucially important to get ourselves to the point where people can run the right kind of practice, do the right kind of treatment, and profitably, and have the best care for patients. And currently that's not the pharmaceutical health insurance model. I mean, it just doesn't. It's forcing people down the wrong paths too often, and people, meaning the patients and the doctors, are trapped in this system of doing things that aren't great for their health, but it's what insurance will pay for, and therefore that's what they do. And I mean, it's literally killing people. or make them very, very sick, and creating chronic illnesses that, I mean, you can just see the epidemics of chronic illnesses as the pharmaceutical, as the number of pharmaceutical drugs in the market has gone up and up and up and up. You can literally track the line of chronic illnesses that have gone up related.
It looks like it's going to rain.
Yeah, and right now in the state of Massachusetts, the governor mandated the flu vaccine, and I'm fighting that. It's a big, big thing in my world right now. But it's supposed to be a test case for the rest of the country, and then who knows what's next. It could be another vaccine that's not even on the market yet, that they're trying to mandate. But there is an increased incidence in autoimmune disease, and we don't know why, and nobody's trying to figure it out because the pharmaceutical companies are flush with cash. So yeah, we have to get out there and explain that maybe going drugless is the right way to go. Anyway, I have another call in a few minutes and I need to prepare for it. So
well, again, we just, you know, these calls are just casual. Let's talk about whatever you want to talk about and answer any questions. I'll just say really very quickly what we're working on right now is a couple things. Building out getting more and more people into the community. So I just put a message out probably 15 minutes before the call. We've created free open enrollment because we realize that the best thing is to have as many people in here as possible. It's funny, you create a community like this and you say, okay, you know, what's going to work? I mean, we had a flood of people in here, and then all of a sudden we put up the gate of nominal fee of $15, and all of a sudden it goes, you know, crickets. And it's like, okay, this is not that's not the right model. So you know, let's get people into this community and as many as possible. So, and I put some sample text that you can just copy and paste, edit, whatever you want, and just let's get people in here and get the thing up to 1,000 members, and we'll all get better benefit out of it.
I love what you're doing, and I'm so excited to be a part of it, and I'm honored to be on this call, and I can't believe it's being recorded. Somebody might listen to what I actually have to say, but thank you so much, and I look forward to the next one. And Joe, I'll see you a little bit later.
Okay, awesome.
Thank you, everybody. Great seeing
I thought I was
you.
muted
Charlotte, really nice to meet you.
Great to meet you, Richard.
What, Joe?
I said, I'm sorry. I thought I was muted when I was talking to my son.
No, not a problem at all. All right, we'll see you. Get the word out.
Thank
Keep
you.
those cards and letters coming in. Let us know what you need. I mean, you can see how fast we turn around. When you say you need something, we'll create a group for you. Or we'll create a library for you. Or, you know.
Yeah, I had a question. How many because I think like the call yesterday was incredibly valuable. It was great to hear all of that. How much of that are you putting on, are you sharing outside of the network?
Oh, it's going out broadly. It's going out on YouTube.
Okay.
Dr. Ernst sent me a note later in the day, said, hey, can you send me the video link? So I sent him the video link both ways in the collaborative to get people to come in, preferably, but directly to YouTube. So
Okay.
yeah, we're aggressively pushing all this stuff out in social media. Rob and I both have huge social media following, not only for our company, but individually. And so, yeah, then that's what we're doing right now is aggressively getting word out, inbound and outbound marketing, and especially our community, because so many people, you're a trusted person in your community, right? So if you say something, say, look, hey, look at this thing, and, come in and take a look, so we try to make it as easy as possible to do that.
Okay, great. All right, awesome.
So great talking today.
Okay.
You have a great weekend.
Thank you. Yeah,
Bye.
my birthday weekend. I'm out.
Oh, happy birthday.
Thanks. Tomorrow.
I'm not going to ask you which one.
Oh, it's all right. 51. I'm not proud.
Awesome.
So.
Well, you have a great birthday.
I will.
Talk
Take
soon.
care.
Bye.
Bye-bye.